There's so many of you listening that are doing all the right things and you're still overweight or you're struggling with your weight. I have the greatest compassion because I know people could look at you and say, oh, they must not be eating right or doing the right thing. And Bree and I both know what that feels like. Like that is so harmful to yourself and your body to take on that mentality, because the truth is your body is doing the very best it can.
Welcome to the Betty Rocker Show, the place to be to nourish your mind, love your body, and rock your life. What's up, rock stars? Coach Betty Rocker here. Welcome back to the show. Today, I'm talking to Dr. Jill Carnahan, a functional medicine practitioner who I've been working with since moving back to Colorado. She takes a very holistic approach to her patient care. And as I mentioned in last week's show, she's been supporting and treating me for the mold exposure and all of the cascading symptoms that came along with that. So we're going to talk about that today, among other things. Here's a little more about her. Dr. Jill uses functional medicine to help her patients find the root cause of their illness and identify nutritional and biochemical imbalances that may be contributing to their symptoms. She searches for underlying triggers that contribute to illness through cutting-edge lab testing and tailors the treatments to specific individual needs. Doesn't that sound wonderful? It truly is. Her background and credentials are impressive. She was dually board certified in family medicine in 2006 through 2016 and in integrative holistic medicine since 2005. She founded the Methodist Center for Integrative Medicine in Peoria, Illinois in 2009 and worked there as a medical director. Then in 2010, she moved to Boulder, Colorado and opened Flatiron Functional Medicine, where she has a widely sought after medical practice with a broad range of clinical services, including nutritional consultations, chiropractic therapy, naturopathic medicine, acupuncture, and massage therapy, as well as her own medical practice. She uses nutrition, supplements, lifestyle changes, as well as medication in her treatments, and always seeks the gentlest and least invasive way to help her patients find hope, restore their health, and optimize healing. One of the things that has stood out to me in working with her personally is the way she makes me feel heard, validates my experience and feelings, and just really encourages me to listen to my body and tell her what I feel and think, and combines that with the data from my test results to create my treatment plan. I really feel like an active participant in my own care, and that someone really cares about me and is doing everything they can to support my wellness. From many of the comments I have received online, this is not an experience everyone has with their doctor, which is especially why I want to interview different doctors I've worked with personally that take a different approach, in the hopes that I can shine the light on other options you have when it comes to your treatments and care. If you're looking for a functional medicine practitioner, I recommend using the Institute for Functional Medicine's online directory, which can be found at ifm.org. Without further ado, join me in welcoming Dr. Jill Carnahan to our show. Hi, Dr. Jill. Welcome.
Hey, thanks so much for having me. I couldn't be more excited to be here with you.
I'm so excited to get a chance to talk to you outside of our normal visits for my care and get to ask you some of the follow-up questions and talk about a lot of the topics my audience has been asking me about. And I can share up to a certain point about my experience. I feel like hearing it from a doctor who treats a lot of these things is the most effective, because you can speak to specifically what I'm dealing with personally, since they all know me. But then you can also shine some light on maybe a broader topic of testing and treatments and things that you've seen in your clinical practice. So I'm so glad you're here.
Thank you for having me. You are welcome.
You have insight into caring for people, and your approach is really unique, I think, in that you are so caring and trusting of the patient's intuitive experience in their care. And I just wondered, I've read your bio, but for those people who don't know, you've had your own health concerns in your life. And do you feel that's given you a sort of a deeper understanding of patients' pain, and how has that been for you? And what do you feel about that?
Hands down, 25, I'll give you the 30-second version, but 25 years old, middle of medical school, I got an aggressive breast cancer diagnosis out of the blue. And for those of you who don't know, breast cancer in young women is a whole different disease. I was in a group of young women under 40 and I'm the only one still living. Like, this is a deadly diagnosis. So I remember just like going in for the battle of my life and all of a sudden going from doctor and student to patient. And I remember looking at the clinicians that I saw for my diagnosis. And again, you've been through your journey too, so you know this well. You can immediately sense someone who maybe they have an agenda, or maybe they really aren't listening. I mean, I had the same thing. I became a patient, and I remember sitting in offices, and one, oncologist said, you can't do any vitamins, not even vitamin C or anything during your chemo. And I thought, you know what? I want someone who's willing to work with me, and fired that doctor. And one thing I learned, and this is part of my own journey as a clinician too, is I love the science. I love to back everything I do by great science, great data, and keep studying and learning more. But what I've learned is, as a clinician, there's a heart piece, there's an intuitive piece, and it comes from a lot of experience, but it's that piece that a knowing, it's like a gut feeling. And they've actually done science on the gut feeling, the gut instinct, and the science founds it as better than scientific data a lot of times for decision making in clinicians who have experience. So what I've learned is to really trust my gut and then follow it up with great science. And because I do that as the clinician and, the partner in health with the patient, I really listen to the patient and find out, what do you feel? What do you think about this? Does this feel right to you? Because you know your body better than anybody. And I feel like I have an idea of science, what fits the general population, but I want to know what's the best treatment for you as a person. And I want to bring in that patient and their experiences. And what I find, you and I have talked about this too, is I tend to see a lot of patients in the mold and Lyme and in chronic infection, inflammation, autoimmunity, very complex, multi-layered illness. And because of that, I tend to see the patients that are a little bit more intuitive, a little bit more sensitive to the environment. And because of that, they tend to have a gift that sometimes I see that they don't even see in themselves. And they're often very highly in tune individuals. And what often needs to happen, I needed this for myself and my journey, is for me to encourage them to have the confidence in their own ability to make good decisions, because I know I lacked that. And when I learned that, wait, I do, like, after the cancer was Crohn's disease, and I sat with a gastroenterologist and he said, Jill, diet has nothing to do with this. And I just looked at him, my heart sank, and I'm like, this doesn't make sense. And my intuition was saying, no, run. This doesn't make sense. Diet does have something to do with it. But because I was in the presence of an authority figure who I thought knew everything, I started to doubt myself. I thought, well, maybe diet doesn't have anything to do with it. But the truth was, it freaking does. And so I learned over my journey to trust my own gut and to follow that gut. And of course, use good authorities, use good counsel. But that's where you're talking about with a patient. It's so important to find a clinician, whether you're out there trying to find someone to work with, or you and I in our own journeys, to find someone who will really listen and collaborate with you as the patient.
Oh my gosh. I'm just like over here, like, oh, preaching to the choir. And also just people need to hear that from a doctor. I think what you just shared, what you went through as a medical student and a young woman, so traumatic and difficult. And at the same time, you were faced with the additional challenge of not being heard or trusted or listened to along the way. And this is what I hear from my wonderful community over and over. Whenever I share things, they're talking about, my doctor doesn't listen to me, or I was dismissed, or I was told this wasn't an issue, or I was told that I need to just get on the pill, or I was told, we as women are dealing with all of these issues. And you nailed it with someone who is an authority figure tells you this is how it is. And you're sort of like, but you didn't even listen to what I said. It's just a terrible feeling to be dismissed in that way.
And Bree, what I learned in my own journey through difficult relationships, health issues, like I've been through the gamut. And the most important thing I learned in my own healing, like physical healing, you cannot truly love yourself if you don't trust yourself. And I learned like that order, I tried to love myself, tried to practice those things and practice those principles. But when I didn't trust my own intuition and was basically denying a piece of myself, that's where, like, if you look metaphorically at the roots of autoimmune disease, it's autoimmune, it's self-attack. There's a metaphor for that. And there's a piece of that. It's not the only cause. There's a lot of other factors, but there is a piece underlying many autoimmune diseases, especially in women, where there's a lack of trust or self-hatred or self-loathing or self-dislike. And as we heal those deep pieces and actually learn to step up and trust our own freaking intuition, it really is part of the healing process.
I couldn't agree more in my own experience as well. And so grateful that you are sharing that. And I've just, been so impressed and felt so like everything I explained to you is validated. It's something that you believe and trust in me. And then you combine what I've shared with you with the data we get from the tests you run, and we co-create, my treatment plan. And that has been just the greatest experience ever, to feel like I get to be a partner in that. It makes me more proactive in my care because I feel like I was part of creating the care plan as well. So I'm sure you find that a lot of your patients are, I don't know, just to have like a good adherence rate to your protocols because they're involved in their own care.
It does make such a difference because at an intuitive place, someone just tells us to do something. At least for me, I'm a rebel. I like to know why. And I want to have this internal sense of, I know I'm doing the right thing for my body. So if someone just gives me that, directive without me understanding, so it's so important to kind of check in. And, like I said, there's a one size fits all from the studies and the data, and it may fit the N of one, which is an, hypothetical person anyway. So it's so critical to check in and even check back. How did you feel on that? And often with patients like you and all of my patients, myself included, we'll start one thing at a time and do, little interventions to kind of check in and see how that works.
Yeah, and that's really been an important part of my experience as well. And you tell me often, and we have a lot in common as women, just you're like, you're a badass, Brie, you really are. And yet you're also a very sensitive flower. Because I feel like this badass sometimes, I tend to go gung-ho into my treatment plan, or I go really hard and fast, or I think, I can do all of this stuff right now really fast. But my body actually needs a little bit more of a gentle approach. And so I've had to put the brakes on a couple of times. And with your support, it's been just a great process of sort of, let's check in with how this felt for you. And do we need to back off? Or, do you want to, it's just been such a great collaboration. And I think that's true of a lot of us when we get told, here's your plan, we go gung-ho for it.
Yes.
And we don't ease into it, right? So I know I'm not the only one who has
I learned from experience after my mold. I was like, hate this stuff, I'm going to kill it, and then I go with massive amounts of binders and things. For 2 months, Brie, I had head to toe hives because I was going way too much. My body was like, please stop. And I was ignoring it. I was just plowing through. And so I learned from my own experience.
You just brought up the mold. I'm so glad you did, because I've been sharing a little bit about that with my audience. And I have had so many questions from people who are like, I want to know more about mold. What were your symptoms? What were the tests that your doctor ran? And then what were the treatments that you're specifically on? So we can talk about my particulars, of course, together. And then maybe you can share a little bit more general as well of things, because you yourself have experienced this, and a lot of people we know as well. But this is not a mainstream topic, which is also really interesting.
In medical school, we're taught there's certain things that are just either left out, or because there's not an agenda over, again, I'm not biased, but a lot of the things are driven by there's a drug to treat this. So we're taught this because there's a pharmaceutical solution. In typical allopathic or regular MD school, it's typically get to a diagnosis or a label. Once you have the label, there's a series of either surgeries or drugs that are appropriate, and that's it. There's never the question why. And for me, that was always I want to know more. Why did this happen? And that's what led me on the path of functional medicine. And I guess if you haven't heard of functional medicine, just a very brief, it's basically looking at root cause. I feel like it's the toolbox plus. We have a larger toolbox. It's still great conventional diagnostic medicine, but what we have is not just drugs and surgery. We have an arsenal of nutrition and diet and lifestyle. And the other piece of it that's so critical is trying to really be a detective and say, why did this occur? And how do we actually reverse it? So back to mold. In medical school, we're taught about mold as an allergen. We know it can cause allergies and asthma, and that's all true. That's this one arm of the immune system. Well, there's a whole nother arm of the immune system called the innate immune system that we've heard a lot about with COVID and the pandemic, because it's the cytokines, and now people are familiar with that word, where the immune system gets upregulated and inflamed. And the inflammation, it's almost like the trigger, the virus or the mold causes this immune activation, but the immune activation starts to go in this perpetual vicious cycle. And that's what damages the body and damages the mind and damages the tissues and all of those things that we see. And it's not really the original trigger. It's this perpetual cycle of the immune system. Well, in medical school, we did not really learn much about that. And we didn't go into depth on any sort of form with mold and how it could affect that. So a lot of this is new teaching. It's new data. It's great science, but it's kind of new to clinicians who maybe weren't taught it in their original training. And like you and I talked right before we went on the call, it is absolutely exponentially growing. Probably I've heard on my platform of how many people, oh, I think I'm struggling from mold, right? And it's so much more common. I think part of it is our toxic load, the chemicals and pesticides and heavy metals and now smoke from fires and things are getting so much more in our environment that our immune system is kind of weighted down under that burden. So we're less resilient to the triggers and things. And then with a pandemic, all of a sudden people were going inside houses or inside buildings and they're afraid to go outside. Well, we know with mold, dilution is the solution to pollution. So if you open your windows and get airflow, you're going to feel a lot better. But if you go inside, you stay at your desk all day, you close your windows, you wall off from other people. If there is an issue in your home or workplace, we saw a lot more people experiencing symptoms because they were shut up inside during the pandemic.
And also what you brought up about almost like there's like a pile on of things in your life. Your body has its own detoxification pathways that are very powerful. And yet, when your toxic burden exceeds what your body can naturally handle on its own, that's the time where we start to feel and see some of these symptoms. I know some of the recent tests that you ran for some of the toxicity panels in my system showed all the different like parabens I've been exposed to in my lifetime, plastics, plus the mold, plus the metals. There were all of these different things that didn't just suddenly happen. My body, my very healthy, strong immune system and strong detox pathways have been handling that load for years. But at some point, I got too much exposure or too many things were piled on and I couldn't handle the burden anymore. And that's when I started to see things like weight gain, couldn't put on muscle, started to have hormone shifts happen and brain fog happening. And all of that happened back in around 2019 to me. And you got your hands on me in 2020 when I moved back here and took over my care. And we did some specific testing. And I had already been presenting with those types of symptoms. What are some of the other symptoms people might present with when it comes to mold? Because you did mention there's sort of a cascade of effects to other bodily systems.
So brilliant description of what happens there. Absolutely perfect. Because I always talk about our bucket. So we're all born with like a bucket capacity. There's other analogies, but I think of it as this little bucket. Some people like me were born with a little smaller bucket, meaning my detox capacity genetically is a little bit smaller or more impaired than the average person. And so I got cancer at an early age or things like that. But all of us have this capacity. And what happens is as that bucket of our lifetime accumulates with the maybe bath and beauty products that have parabens or phthalates or perfumes or heavy metals in our environment or mercury amalgams or lead in the paint in our homes growing up, chemicals in our groundwater or our water supply, or the air that we breathe when there's smoke or fires or things. There's just so many sources. And as those things accumulate in our bucket, at some point we reach that cutoff where the bucket starts to overflow and then we start to have symptoms. So we have a lot of reserve. We have a lot of resilience. As you said, I love that. Our bodies were made to detoxify. And even when the bucket's full, there's always hope because all it is getting that water level down so that you have margin back. Once you have margin, our bodies are detox machines. Like we're created to do this. So even in the worst case scenarios, we usually can overcome this. But what happens is as that bucket gets full and in this environment with the smoke, with the fires, and then you throw stress in there, and stress is a known suppression of immune system, suppression of detox, lack of sleep. So these very real stressful things that are happening in the last couple of years are absolutely affecting the body.
Not to mention past traumas that are adding stress to your system that maybe you haven't resolved. Sorry to cut in, but that's just another piece. I'm just thinking, oh my gosh. And then there's the like, you're having relationship stress or you're having all the other things in your life that are a struggle, and maybe you're not eating well, maybe you're not following your 4 pillars of health like we talk about, you guys, like all that helps build your resilience. So wow. So please continue.
Yes, it's
so interesting.
So true.
I love the bucket. The bucket is such a great analogy.
And it's so good because then it gives hope too. Because number one, if you're a clinician or someone like me, I don't have to know every last drop of water in the bucket. That would be overwhelming because the amount of chemicals, a toxic load to figure out every last piece. All I have to do is give that patient back a little margin by downloading that bucket. And that's doable for all of us, for patients or clinicians. And the other thing is we all still have that capacity. So mold, what it does though, it's particularly sinister because it trashes a system that relates to making glutathione. Glutathione is one of our master antioxidants. It comes from the liver and is produced by our body to help us get rid of and excrete toxins. We excrete things through our sweat, through our urine, through our stool, through our skin. And even through our lungs when we breathe. So there's all these ways that we excrete, and glutathione helps some of those processes for excretion. But when we get a mold exposure, it's almost like it uses up our capacity to detox. It kind of trashes that system. So not only is it a super toxin, but it really trashes our ability. So like you mentioned, when you saw me, and I see this really commonly, patients present and they have a high mold level, and we'll talk in a second on how we measure that. But what happens is that mold will have trashed their detox, and they look like they're very toxic in other ways: chemicals, phthalates, parabens, VOCs in the environment, endotoxins in the gut, lead, heavy metals, etc. And the problem really isn't all that toxic load, although that's a piece of the puzzle. The bigger issue above and beyond that is that mold exposure has completely impaired their ability to excrete toxins. So I never get super alarmed until we first take care of the mold issue and restore that glutathione detox, because then we are detox machines. And that's the hope I want to give every listener, is we are created to detoxify. That's what we do. We do it very well. So all we have to do is give our body the right materials, the rest, the sleep, deal with the trauma, take in the right nutrients, all of these things that we'll talk about, and our body will detoxify. And then with mold, you have to get out of the exposure.
That's a big piece, isn't it?
It's a big one.
Mm-hmm. Yeah. And so people need to, I think, you have on your blog, by the way, guys, she's got an amazing blog on her practice website, jillcarnahan.com. And then you can go to, there's all these blog topics. And one that I particularly appreciate, there's a whole section on mold exposure, environmental toxicity, all these different things. But one of your articles, you do talk about testing for mold in your home and helping get yourself away from the trigger. And obviously we can start to, have an effective treatment, because if you're continuously being exposed to the same thing, you're not really going to be able to get better, right?
Yeah. So rule number one that can't not say multiple times today is, if you suspect mold exposure, first thing, don't leave your house, but you need to check it. And one way, granted, environmental air quality specialists and mold inspectors are amazing. You may need someone like that at some time, and most people do, but you can start on your own with what we call qPCR. It used to be called ERMI, but the way the ERMI test scores, we don't really feel like that actual bottom line score is valid. But the numbers, this is like checking for DNA of mold in your dust. It's a really simple test. It's like taking a cloth where you collect dust, you send it into the companies. There's a couple out there. If you search for ERMI, ERMI, or qPCR, you can find them. And basically, they will test for DNA of mold. And then we look at the sample and we see the species. And if there's a lot of different things that shouldn't be there, there's probably an issue. And then at that point, you'd want to get an inspector to say, well, okay, there's mold in the dust in your house. Where is it actually coming from? Because you have to find the source. And it might be the common things that you might, like a dishwasher leak, a washer dryer front loads can often have mold, or if it's leaked, anything that's ever leaked, your kitchen sink, your master bath, if your attic isn't properly ventilated and there's condensation in the attic, if a storm has caused intrusion of water through your window, if your sump pump has leaked, if there is water coming up through the concrete of your floor. So as you can imagine, as I am stating these, there's lots of ways that water can come into your home. And if it's not taken care of, or if it soaks up into the drywall of your house, it's going to create mold in your house.
And then we have to test our bodies, right, to find out our burden basically from there. So can you share some of the tests that you have? Because if people are working with a doctor who's maybe not as familiar, they might be able to ask for these types of tests to be run.
Sure. And can I mention, I have no affiliation with the companies, but if it's okay, I can mention brands and everything.
Yeah, please do. Because I promised my audience I would share exactly what you use to test me, and maybe some of the other common tests available out there, that whatever your clinical opinion is of them and what you've seen in your practice, if you feel comfortable.
Sure. Yeah, I think it's super helpful. So for the ERMI, the qPCR that I just mentioned, that is testing your house. There's two main companies, Envirobiotics and Mycometrics.com. So those are the two big companies that do that. You can order them yourself. You don't need a doctor's order. And you can start there and then, ask your doctor's opinion, ask an environmental expert, and get some information. And like we said, that's your house. Now onto your body. First of all, the $1 million question we both have gotten, Bree, is what's the one test for mold, right? And I want to be clear that there is no one test for mold. There's a picture and a history. So how I approach it is, certainly we want to check the environment. But I actually just listened to the patient. And as Bree said, I kind of glossed over this, but common symptoms would be brain fog, fatigue, difficulty with concentration, memory, word finding. So saying cat instead of dog, or not being able to remember names like specific words. Things like trouble breathing, chronic sinus issues, congestion, waking up in the morning really stuffy and foggy, skin issues, rashes, anything to do with histamine or mast cells, which could be rashes, itching, new onset like red eyes, irritation of the mucous membranes. Gut can be affected, so diarrhea or constipation. Heartburn is actually really common. New onset issues with the gut, inflammatory bowel disease, new onset autoimmunity. So there is a long list of symptoms, but if you're having those and you always have them in a certain environment. So for example, you go away on vacation, you feel amazing. I've had patients who go away camping, they feel amazing, and they come back to their home and they don't feel so well. So if it's dependent on environment and you have some unusual symptoms that haven't been able to be solved, that's where you start with looking for potential mold. We mentioned testing the environment, testing the body. So that history, that asking the questions like I just asked with symptoms is important. And where does it happen? Does it get better or worse when you travel? Those are the kind of things. Testing the body, we have a couple ways. There are blood tests that show inflammation of that innate immune system. These are complex and they're not going to be familiar to the typical doctor who maybe hasn't looked into this. So it can be a little bit harder to get these ordered. I'm just going to mention them. So if you want to know what they are, it might be possible. They can be ordered on Quest or LabCorp or most any local hospital lab. So these are routine labs. They're just not your run-of-the-mill like blood counts like hemoglobin. And those kinds of labs are typically normal. So when you do like a liver function or kidney function or blood counts, those things are going to look pretty normal in a person who has mold illness. So they may look pretty good. Your doc says, everything looks fine, come back in a year. And you're like, but no, I don't feel well. So some of those blood tests would be TGF beta, VEGF, VEGF, MSH, melanocyte stimulating hormone, antidiuretic hormone, and osmolality. VIP can be done. You can check anti-gliadin antibodies, and MMP9 is another common one. So those are, again, they're kind of esoteric, but they do. And none of those say by themselves if they're abnormal that you have mold, because what they say is that innate immune system is just a little bit fired up. But we don't know why for sure. But say out of all those tests I just listed, every single one was abnormal. Well, I'd highly suspect mold. The test you and I were just talking about that's a little bit simpler is urine test for mycotoxins. So what this does is, so we have mold spores, which an environmental expert may test in your air. You can't test for spores in the body very easily. They're just not testable. And typically those whole spores, they don't typically go into the body or stay in the body unless you have like a colonization in the lung, like a fungal ball or a ball of mold in your lung, which is pretty rare. But what we can do is check the products that the mold produces, which is mycotoxins. These are like VOCs or like solvents, almost like if they were smokes or fumes. So we breathe them in, they go right through our skin. They're very absorbable in our bodies. So if we've had a significant exposure, we can actually measure the excretion of these toxins in our urine. And there's three main companies right now that do this. One is called Real Time Labs, one is called Great Plains Labs, and the third is called Vibrant Labs. They each have different technology, they each are valid, and they each have their own pros and cons. The one I think you and I did was Vibrant. I really like that test, and I've been using that lately. These other ones are great too. But what we find is a really good sensitivity for the mold toxins in the urine. And when we see them, especially if we see, oh, there's a mycotoxin from Aspergillus, and then we look at your environment, and we also see Aspergillus on the dust sample, it's like match. We know that that's likely the source of exposure.
Right. And each of the molds, of course, after I saw my lab tests, I went and looked up all the different things that were presenting, where in the environment they could have come from. And I was like, oh yeah, check, and I'm so glad that I, had moved already away from the exposure and now have the opportunity to treat it. The weight gain piece was a real challenge. And so was the lack of being able to put on muscle. Now, I don't feel like those are like direct symptoms of mold. However, because mold has an impact on so many other symptoms in our body, is so connected, all the systems integrate. I feel like it impacted my gut health, then it impacted my hormone health. And we've had to work to treat my hormones. But we didn't do that right away. Like we talked about before, Dr. Jill took a very methodical approach, treating different systems and working with my body so that I wasn't overloaded. I will tell you guys, I was impatient many times with this process because I wanted to feel better and I wanted to see a change in my body. But I had to come to this sort of like peace with the process because I knew I was in good hands. And I saw what happened when I tried to rush the process. It didn't work. It backfired. I would end up being wiped out or I just couldn't function. So the good news.
I think one time I was like, Bree, what did you do? Oh, okay. Let's talk about that.
Let's talk about that. Exactly. So with the test results, and thank you for giving the detailed data about what tests you use and that they're all valid. They all show different information. Different doctors are going to work with different things. And then there are these other symptoms that can be going on at the same time, which may be connected because your immune system is suppressed because of how mold attacks your whole, like your liver, your glutathione production, your ability to detoxify. Talk to me a little bit about the hormone cascade and the issues with estrogen and liver and processing all of that.
Yeah, so mold toxins affect leptin receptors and a bunch of receptors in the hormone pituitary axis. So these are nasty little chemical toxins that kind of like throw a wrench in the receptors and either block the production of a hormone or a process. So we see a whole bunch of different things. Some of the things we see are antidiuretic hormone. This hormone is responsible for conserving water. So when we drink, if we're thirsty and dehydrated, the volume stays in our vascular system. We can get up and stand up and walk around and feel good and feel hydrated. When we get a mold hit, one of the most common symptoms I see is frequent urination or increased thirst. And this happens because mold will trash that. It's called vasopressin or antidiuretic hormone, same thing. And that ability for us to regulate the hydration in our body is completely blown apart.
This has happened to me.
Yes.
Yes.
Me too. Yes. So we drink and we pee and we drink and we pee and we feel dehydrated because it's almost like no amount of water. Our body's regulation system is impaired. So we could drink all day long and we could still remain dehydrated. You'll see this also we've talked about before by skin integrity and the plumpness and youthfulness of our skin. We become more dry. We look older. We become more skin dryness and issues with that. And even people can have hair fallout. There's a whole nother pathway related to histamine production. And when people don't know is, first of all, mold is a massive trigger to mast cells. Mast cells are primordial cells in our immune system that throw out all kinds of nasty things like histamine. It's supposed to protect us, but mold will really trigger that. Histamine can cause chronic heartburn. It can cause hair loss. It can cause rashes, allergies, like lots of symptoms, gut permeability issues. So we have this antidiuretic hormone with frequent pee and urination. That's broken. Then we have this throwing out of mast cell activations, the histamine, which basically makes us an allergy factory, the histamine factory. We lose hair. We have heartburn. Our gut's destroyed.
I was itchy all the time.
Yeah, I had rashes all over my body too. Yep. I remember that well. So that histamine thing. Then we have the hormones. And what can happen here is it can definitely have dysfunction with thyroid, where you actually look to a normal doctor's labs. Everything looks okay, but you're having either subclinical symptoms or you're having receptor blockage. So your thyroid hormone that is being produced is not working. And then you can have weight gain or fatigue or bloating or other things. It also affects the adrenals, and this can either cause really high cortisol, which is very damaging to tissues. There's this thing called catabolic and anabolic, and all that means is we either break down tissues. You know this well with weightlifting and stuff. When we want to maintain muscle, we want to be anabolic, which is building muscle, and not catabolic, which is tearing down muscle. Well, anytime we have an excess of cortisol, we're going to be tearing down muscle instead of building it. No matter what we do, we can work out every day, hours a day, and it won't build muscle. We're tearing it down, and we're basically fighting against that high cortisol. And cortisol is a stress response. You mentioned this earlier, but I love talking about this, Bree, because it's so profound and people get it. When you've had old trauma or stressful triggers or things that you maybe haven't dealt with, when mold comes along, it will often trigger old trauma because it's not like it's a trauma necessarily like, oh my gosh, I'm afraid of mold, although people do get that way. It's more that your body's limbic system senses a very dangerous invader. And even if you're healthy and you've done therapy and you've done all the work, it's still a very traumatic trigger to the body. So in many people, it'll raise cortisol and create this kind of limbic response that's a trauma loop, really. And if we don't address that along with everything else, people get stuck in that cycle. And even if, again, they're healthy, they're balanced, they've got great relationships, they've got a therapist they work with, this physiological trauma trigger can happen. So there's thyroid, there's adrenal, there's loss of muscle, there's histamine, and there's the regulation of water in your body. And then the thing you just mentioned is hormones. So hormones are huge. The main thing that happens with mold is it upregulates aromatase. Aromatase is an enzyme that takes testosterone and makes more estrogen. So not a terrible thing. All of our bodies have it, men and women. But if men have this happen, all of a sudden libido goes down, risk of diabetes go down. They have weight gain around the center. They have man boobs. They have lack of drive, motivation. And women will have fibrocystic breast, endometriosis, excessive bleeding, horrible painful periods, moodiness, and low libido, lack of muscle, all the wrong stuff. So that aromatase pathway is a really big deal because mold tends to trigger that as well. So as you can see, this affects, and I didn't even talk about some of the other systems, but it affects all of our hormones and really can mess with things. And as you can also imagine, if you come in with heavy periods or you're thirsty and dehydrated, those aren't things a typical doctor is going to say, oh, I think it's mold, because it's such a kind of a vague type of complaint.
And it could come from any number of other things as well, right? So it takes somebody who is like a Nancy Drew to go investigate like what is going on at the root cause of this specifically. What are these symptoms that are presenting to me? You know, it could be part of a larger problem. Maybe I'm just seeing the tip of the iceberg here. Let me go delve down and try to get some more information about this. And you talked about aromatase and how that impacts estrogen, and it also, you know, my cycle was really irregular. It just couldn't get it back on track. And that was very odd because I'd been very regular for many years. And I was like, am I in early perimenopause? Which could have been a valid piece of that, but probably wasn't, because, you know, I had these other symptoms presenting along with it. So it really took just trying to solve the mystery and then trying to treat the different symptoms and the different body systems effectively and not overwhelm the body. So it can be a complex treatment protocol, at which I'm sure you would say it's complex. It's not like simple.
Yes. Well, and one thing we've talked about before is that's so frustrating. And I had this too, Brie, where we have the weight gain. I didn't talk a lot about that. The hormones have to do with it, the cortisol, the thyroid, all of these things. But the bigger thing is the leptin receptors get broken, basically. So you could stop eating or eat 500 calories a day or really restrict or do all kinds of things. And it's almost like the ability to burn fat is not functioning. And one of the things we talked about that's so frustrating is, at least for me and for you probably too, that's like, okay, let's get back in shape. We know how to work hard. We know how to eat well. And until you get the detox part done, it's really hard to budge the leptin resistance. And it's so freaking frustrating, right? Like to feel that.
It is.
Like I want that to happen. And yet you have to get the detox first. And again, I think we had some conversations around that.
And that's been really helpful because like you said, it's hard and it's mentally like, especially as a trainer who presents, you know, my fit, healthy body based on my lifestyle practices, I wanted to be able to truly represent like how I was taking care of myself, because that truly was what gave me my physique. And yet when there are underlying health conditions present, you can't always do your lifestyle practices alone and that's going to be enough. But at the same time, we have to continue to practice those healthy lifestyle practices, because that, along with your treatment plan, is what's going to help you get through it. So for me, a big mental piece, a big, really helpful thing that happened, I'm glad this happened, because I am grateful that I was able to find peace in the fact that my body changed, and that was okay. And that I was so grateful for my body to its ability to heal. All the things that it was doing were natural things that it needed to do as I went through this treatment. And I think just the shift in my mindset around that, I do not have like a feeling of, oh, I don't like my body. I was like, whatever, you know, and I think a lot of that acceptance and that love for myself as I went through it has really helped me. I think I'm healing faster, honestly, as a result of it, because I'm not fighting with myself. You talked earlier about the self-love piece and the self-trust piece. And I just feel like that was a huge gift of this experience for me, of just really finding that I wanted to practice that I came to that. And that was what gave me the grace.
Brie, this is so beautiful. And first of all, I just want to say publicly, it is so beautiful and brave of you to share your journey, because so many people out there listening are experiencing the exact same thing. And we as women are taught that we're not lovable, we're not acceptable unless we have the perfect image of hair, makeup, body. And you and I, we live that, we work hard, but I've had times in my life too where my body doesn't cooperate because I was sick. And our body, like you said, I loved what you said. You're such a great example of this. And that is like, hey, like I've literally in my own healing journey been like, oh, thank you for being so strong and so good and so brave. Thanking my body, because there's been times when it's been frustrating and I felt like, oh, come on, get with it. Like, why aren't you cooperating? And that does not help us heal. So we have to come to that love and appreciation for what our body's doing. And I loved that you said our body's doing the right thing, because what it's doing is protecting us. When we get a toxic load, it tries to dilute that toxin by storing a little bit more tissue, which typically comes in more weight gain. And that's a protective mechanism that's happened. That's why we're seeing the epidemic of obesity and some of these people struggling. And I know you listeners out there know this. There's so many of you listening that are struggling. You're doing all the right things and you're still overweight or you're struggling with your weight. I have the greatest compassion, because I know people could look at you and say, oh, they must not be eating right or doing the right thing. And Bree and I both know what that feels like. Like that is so harmful to yourself and your body to take on that mentality, because the truth is your body is doing the very best it can. And when we start to accept that, and then the problem is too, we have to accept the timeline of our bodies, which isn't always our timeline. But thank you for sharing what you have, because your listeners so need to hear this and need your role model. It's so critical.
Thank you for helping to be here to talk about it with me, because you make it such a more powerful and empowering conversation. Getting to have like a public conversation with my own doctor who's taking care of my treatment. I mean, the education that you've given me about mold and about how my body works, I mean, for me, that's been huge, and just the whole acceptance piece and in loving my body, because understanding how the body is healing and understanding all these different systems, just having that piece in my mind has really helped me hold that space for myself, because I'm like, hey, I understand what's happening in my body. So I want to support myself in this process. I want to eat as healthy as possible. I'm not going to start eating a bunch of sugar, which is going to contribute to more inflammation when my body's already trying to. I like to picture the body as this, like all the cells and all the helper systems in the body is like all this team. It's this huge team, right? Working constantly and tirelessly for my benefit. And what happens is if I tell myself I'm not doing enough, I need to go do more workouts because I'm not losing enough weight, or I need to go do more. I need to eat less. What I'm doing is I'm robbing my team, my support team, of the support that I can give it to help it do its job, right? If I'm like, I need to go train harder, more, I'm taking half of my reserve team and putting them on another team to go deal with the inflammation and stress that comes from a workout, and taking them away from the healing process. So I've had to be very mindful of my energy needs as I've gone through this process and train in a balanced way. It might be a little less, and it definitely was less in the early stages of my treatment. But you and I have talked about this process is working because, Bree, your energy is come back. You may not see big body composition changes yet, but those will come. The fact is that you are making progress. And I say this to a lot of my customers and fans a lot when I'm like, the process happens internally first, and then it happens externally. So we have to give ourselves the time and the space, because like you said, the body's on its own timeline. We have to support the process and not just flip from one thing to the next and try to overdo it, because then we damage the ability to go forward.
Yeah, for all you overachievers out there, we're the poster children.
Exactly. Well, we're both preaching this, because this is like Dr. Jill and I both, I think we've been such overachievers, and there is like this high standard, that we have for ourselves, and women in general have for themselves. Women are so powerful, so capable, just amazing, amazing beings. Like, I just want to honor all of the women listening right now and all the men who support them. We love you too. And we need you in our care and in our support process. But the women listening, you are so amazing, and you are doing enough. You're already doing so much. And I just want to remind you that you are so much, and you are doing so much, and you are doing enough. Very likely.
I love that. Bree, if I could share just a really quick little story, because this is so relevant. One of the shifts that happened with me. So I mentioned 25 years old, breast cancer, fought that battle. 9 months later, I came out of 3-drug chemo. I was hairless, bald from the chemo. My body was ravished by the drug. I had radiation, and I was healed. But then I went on 6 months later to get the diagnosis of Crohn's disease, which is an autoimmune diagnosis of the gut where the body attacks the gut lining. Now they're connected. All this stuff was connected, but again, went for the battle of my life and found out food does matter. And I changed my diet and did stuff with work with my microbiome and became healed over a couple of years from both breast cancer and Crohn's. Now I'm just saying that because I don't know, maybe 8 to 10 years later, I got a massive mold exposure. So I was going along after the Crohn's, breast cancer cured. Those were in my past, and going along really healthy, robust, living my life in Boulder. And I got a mold exposure, and it really made me sick, just like your experience. That's where a lot of my knowledge comes from. And what I did initially was start with the same mentality I did with cancer. I fought the cancer. With Crohn's, I fought the Crohn's. So I was like mounting up this response, this iron will, and I'm going to fight this battle and win. And then I remember walking one day with my dogs, and I had this massive awareness that, oh my God, mold, the way it does its attack on the body is it triggers your immune system. It triggers, like we talked about, and then your own immune system becomes fighting and angry, and it starts to do this perpetual cycle that causes damage. So it wasn't that I was not fighting. It was that my body was in an active state of fight or flight, too much fight. And when I had this realization, I thought, oh my goodness, my idea, my mentality, my self-talk around fighting this battle is going to kill me.
Oh my gosh.
And right there, I literally was like, oh, I've got to reprogram this. And you know what came to mind? You'll laugh. The movies on the Minions, the little yellow guys. And I literally started every day with a meditation. And these minions were my immune system. And I would meditate on having these happy immune system minions. You'll see if you come in my office next time, I have a big minion down at the bottom to remind me of this. Like it literally is my reminder. And I started every day visualizing. And what they were to me was just an example of a friendly, they were just like whistling and working away. They were happy. They were not fighting. And they were escorting the mold out with a peaceful, just like, hey guys, you're not welcome anymore. Let's take you out of the body with the detox pathways. And you know what? You may think that's crazy, but that's what shifted my health. I stopped, and it's relevant because we just talked about powerful women and we overcome by fighting the battles. In this battle, if you're dealing with mold, you have to lay down the sword and have peace with yourself, love yourself, trust your intuition, and let your immune system be friendly and not fighting, because this whole mentality makes it worse.
Wow. Oh, I'm going to use your minions in my own visualizations. I visualize light usually and movement through my body in that sort of a way, but I do also do a visualization process that just is supportive to myself every night before I fall asleep. And I find it so incredibly healing, but I love the minions because they embody the work that's really being done in your body. Yes. And they are happy and goofy. And
they're
they
joyful.
Love you.
They're not like angry.
Joyful.
Exactly.
Yes, exactly. Oh, thank you so much for sharing that. That's so wonderful. I think the one last piece about mold that I want to make sure we talk about a little bit is the treatment protocols. I'd love for you to share what we're doing for me specifically. Now, I have very specific mold strains that we're treating, but I just want to share, like, I'll say what I'm doing and then you can add to that. So I've started at this point, post our last test, I'm using active charcoal, and shout out to Bulletproof Charcoal. I love their charcoal. I'm using chlorophyll tablets. I'm using bentonite clay, and we're using a tablet form, just one. And we also have me on a prescription medication called Welchol, which I hope maybe that you can explain a little bit more about what that's doing for me, because I know it's a binder, but it also is helping because my cholesterol has risen in response to some of the stuff going on with the mold. So those are the 4 specific things I'm currently taking, but then there are a host of other supplements. I'm taking glutathione. I take vitamin C and D. I take vitamin A. There are other supplements that help support my kidneys. I'm using an electrolyte in my water because of that thirst. I'm constantly thirsty, but wasn't hydrating. And even my acupuncturist was like, your kidneys need support. You know, you're not hydrated. Are you using an electrolyte? So those are just some of the things that I'm personally doing at Dr. Jill's behest. But I also would love it if you would share some of the other, maybe tell us about Welchol and tell us some other treatment type things that you've recommended in the past for people with mold.
So great overview, because you just kind of did the bundle of the basics. That was perfect. Yeah, the perfect. And just so you guys understand, if you're listening and like, I don't know which supplement or whatever, I just want to explain the process because then it'll help you decide what to do. So what you're doing is you're supporting our liver takes toxins out of our tissues and it converts them into water-soluble metabolites, and then it dumps them into the bile. And the bile just drips into our gut. and it excretes out into the stool. But our body is so very resourceful that it recycles 95% of those bile acids. So you're recycling toxins all the time, unless you actually use something with a charge, which are some of the named binders that Bree mentioned: charcoal or clay or zeolite or chlorella, or prescriptions like cholestyramine or Welchol. And all of these things, and there's more, but those are just some of the most common ones, they have slight charges. So they're almost like you take a magnet with some metal filings on your desk and you're pulling them along. They're not like an iron grip. So sometimes this is what happened to me. When you start your process of binders, if you take too much, you get worse because you're getting a little exposure as they pull them out of the body. But the reason that works is because you're actually taking that bile and escorting it out in the stool with a charge versus letting it recirculate in the body. So the binders are key. And then Bree mentioned glutathione. Glutathione is the thing that gets trashed and we don't make enough in our body. So often we'll supplement with glutathione. Or she mentioned some precursors and things that make glutathione can also work. Some of you out there won't tolerate glutathione. And if that's the case, you can take vitamin C, you can take glutamine, you can take selenium, you can take NAC, N-acetylcysteine, or lipoic acid. All of these things are precursors to glutathione. And then one other thing I always do is support the liver. One of my favorite herbs is milk thistle or silymarin, and that's a real powerful, because you're basically working with this liver pathway to detoxify the body. And at the very core, the principles of getting well from mold are get out of the exposure or remediate or do something about your exposure. Number 2 would be enhance your glutathione production with some of the stuff we just talked about. And number 3 would be take some sort of a binder. Now, binders can be taken away from food most of the time. There's a few unique substances like humic fulvic acid that can sometimes be taken with food, but generally they're empty stomach because you want to bind that bile acid. You don't want to bind minerals or food with it. And again, those can be taken. Typical courses here, we're looking at 6 months up to 18 months. It's not a short process, but you should start to see some progress. In the first few months, you may get worse before you get better. And part of that is modulating how quickly you go, because if you push too fast, as we well talked about, you're going to feel worse and it's not good for your body. So that's the basic principles on treatment.
I love it. Thank you for sharing those things. And like you mentioned, some of those are prescription medication, but other binders are, over the counter. You can just buy them online or in the grocery store, and they're really helpful and gentle, but they are effective and they're supporting your body in that way. So I'm really grateful that you shared that. And that, the fact that we're talking about the difference between stuff that you get prescribed, stuff you buy over the counter. I'm talking to you, a functional medicine doctor. My listeners have a variety of access to care. And one of the things that I find really difficult to answer, and my heart just breaks, is when someone is like, I can't afford this care, or like my healthcare plan doesn't cover that, and in working with you, full transparency for you guys, like I pay out of pocket for some of the visits, and yet a lot of my insurance covers a lot of the stuff that I'm prescribed. My insurance does not cover my supplements. I have to pay out of pocket for that, so maybe I've sacrificed some other things I would have wanted to do recently in order to put some budget towards some of these things I need for my treatment. But I'm fortunate to be able to do that, to be able to move my budget around in that way. Dr. Jill, I know we talked a little bit about this. What are some of the things that people can do on their own? What are some of the ways that you would suggest navigating this very difficult arena of when it's expensive? How do we get around that? What can we do for ourselves in the meantime?
Yeah, so this is such a big deal, and I want to really acknowledge it because I know a lot of functional medicine practitioners, even like myself, are cash-based. One of the reasons that is just because we can get outside the insurance system and actually work for you. So here we are like trying to do the very best thing, and we're not told by another business person in the insurance company what we can and can't order. All that aside, even so, I know it's out of the realm of affordability for some people. So what I feel like right now is there's so many free resources. Bree mentioned my blog on my website. I literally write articles every week, and part of that is just because I want to reach the people who can't see me. And I put like protocols, I put stuff out there so you can actually take this to your doctor. I've had a lot of patients do that, or even start on your own. A lot of this stuff you can start on your own if you don't have a doc. ICI, it's ISEAI.org. This is a nonprofit organization of doctors that are trained with mold-related illness. And there's also remediators. So if you need free resources or to find a doctor in your area, you can go to ISEAI.org and find resources and docs and other referrals. So that's a great resource. I wrote a free mold guide, and I think the easiest way is if you just Google Dr. Jill free mold guide. It's like 12 pages, what to eat, what to do, how to clean your belongings. It's free. And I literally did that because that guide could get you 75% of the way without any medical, practitioner. And a lot of the stuff, granted, it'd be great to have an advisor and a medical practitioner when it gets complex. I highly recommend that. But I know it's not available to everybody in some areas. So a lot of this stuff you can do on your own. And there are so many docs with ICI, the awareness you're bringing, Bree. You've got to find good sources, but there's so much great free information out there right now.
Yeah. And even in working with you, it wasn't like I just stopped looking up my own information or stopped researching before I got to you. And even before I suspected it, I was researching it myself, found a ton of great information. And, I will say like some of the information, it feels contradictory, but we're all our own personal experiment, and you've got to go based on the symptoms you feel you have. A lot of stuff may not be mold. That's why you should test your environment and test how you're feeling. I feel like you gave a lot of really great tips in this, very practical, applicable tips that someone could start with just in this interview today. And then like your website, like you've said, there's a ton of really good articles about mold. And then I found so much information about mold and treatments. And it's becoming, like you said earlier, more and more accessible as this becomes more and more known about, more and more people presenting with these types of symptoms, people asking for this information, people like me maybe talking about it publicly to my audience. It's not a mainstream condition yet.
Yeah.
Yet.
And thank you, Bree, for your platform, for bringing this. And I'm honored, I want to say publicly, to be on here with you, because it really is so important. Thank you for seeing that and for bringing this to your listeners.
Oh, and I'm so grateful for you, and your Instagram at Dr. Jill Carnahan is a great resource. Your free mold exposure cheat sheet, such a great resource. Is your website, your upcoming exciting new things. Do you want to share anything about what's coming up for you that we can look for?
So January, COVID hit and we were all in a pandemic. I'm like, I want to be able to really inspire and reach more people. And I just came to my heart, I need to do a documentary. And I was like, that's crazy. But I moved forward. Literally, I was like, what am I doing? Well, anyway, long story short, I got a team together. We got the funding, and we are actually completely in production mode with the documentary and hoping to have it out next fall by the 2022 Sundance deadline. So stay tuned, because I'll have a documentary coming and a book. And both of those follow. It's not really about me, but I use my journey as a mirror so that you as a patient or a listener or whatever can see some of yourself in those things and hopefully have some inspiration and guidance along the way.
Wonderful. I'm sure people will be looking for that, especially for that topic. And I want to just leave our listeners with a challenge that they can do in the coming week. And just remember you and your great guidance. So do you have a challenge in mind that they can take on in the coming week?
You know what? I think the most important thing, I'm going to give away something to you guys. At the core of our documentary, we sat with the production team and said, what's the real message here? It's functional medicine, environmental toxicity, mold. That's all important, right? But at the core are 3 principles, and I'm going to kind of challenge you to find these in your own heart and life, because this is where healing happens. Number 1 is believe in yourself. Kind of like we talked about, believe. So B. Number 2 is love. Love yourself and love others. And number 3 is T, BLT, trust your intuition. And those 3 right there, this may sound like woo-woo. I'll tell you what, this is the core of a healed and healthy life. Believe in yourself, love yourself and others, and trust your intuition. So I just challenge you in your quiet time, on your walks, whatever you do for you, is take those and integrate them into yourself, because that's where the power to heal really comes from.
Oh my gosh, the BLT challenge. It's so amazing. I love it. Thank you so much. And thank you so much for your time and generosity, and for all the great care that you have been giving me and all the other patients you serve. Thank you so much for being here today.
You are welcome. What a joy. Thanks for having me, Bree.
Wow, you guys, that was a lot of amazing information, and I really hope it was helpful. I continue to progress in my healing journey and will continue to keep you updated. Know you can access the links mentioned in today's show on the show notes page over on thebettyrocker.com/podcast, and leave me questions and comments there as well. Now, coming up next week, I've got part 1 of a 2-part series with Dr. Stacy Sims, who is going to be talking about training and eating around your menstrual cycle and through the different stages of your life, so you can really take advantage of your amazing female body. This is such an important topic and one I've been super interested in, and I know many of you are too. With the empowering and science-based women-specific information in this 2-part series, you'll be able to tailor any workout program to suit where you're at and get some amazing insights about eating to support your goals as well. It's all coming up starting next week. Thank you so much for listening. Thank you so much for your amazing reviews of the show. It means the world to me, and I just love being able to connect with you in these conversations. So till next time, I'm Betty Rocker, and you are so awesome and amazing. I'll talk to you again real soon.
This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Brie Argetsinger, Betty Rocker Inc., and the producers disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. Before starting a new exercise, fitness, or health protocol, or if you think you have a medical problem, always consult a licensed physician.